Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. The Family Health Podcast is brought to you in partnership with Things Happen, a trusted financial advisor that supports new parents and their families. Things Happen offer the best advice to help parents and their families make informed financial decisions, ensuring a secure and tax-efficient future for their children. The team at Things Happen are highly qualified financial experts who will guide you through the different types of policies to consider as your family expands, taking the stress out of decision-making by finding the best deals for your needs, ensuring you and your family are protected no matter how busy life gets. If you already have life insurance, Things Happen will carefully review your existing policy to ensure that it still meets your family's evolving needs, so you know your family is fully protected. Hello, I'm Kate, and I'm the founder of Mini First Aid. Welcome to our podcast, Family Health by Mini First Aid. I am delighted that you've taken the time to listen to our podcast, because whether you're in the car, you're cleaning the house, or perhaps you're relaxing with a lovely cup of tea, our Family Health podcast covers a huge range of topics that might affect one of your family members. And if you've ever got a family health concern and you're thinking, I'm just going to Google that, please don't. Please have a listen to us instead. Now, this week, our guest is the wonderful Dr Lillie Parker. Lillie is an NHS paediatrician with over a decade of experience caring for children and young people. Lillie is going to talk to us today about respiratory illness with a special focus on bronchiolitis, which nearly all of my 6 children have had. So I'm really interested to dive in even deeper on this topic. A very warm welcome, Lillie, to the Family Health Podcast.
Hello, thank you very much for having me.
Lillie, we're so happy to have you here today, and we know that our listeners will be suffering through the usual round of coughs and colds at this time of year. But before we kick off and delve into coughs and colds, tell me a little bit about yourself.
Thanks, Kate. So, as you mentioned, I am an NHS paediatrician. So I currently work in paediatric emergency medicine. So you'd find me in an A&E department, and I look after kids from newborn babies all the way up to 18-year-olds. So a huge spectrum of different ages and presentations. I do illness, injury, but my background, I've trained as a paediatrician, so I've also spent time working in neonatal intensive care, or I've spent time working in paediatric surgery and in paediatric intensive care. I trained at Southampton University, and I still live on the South Coast, which I absolutely love where we live. And I guess I became a paediatrician because when I was in my gap year and at university, I worked as a nanny. So I looked after initially a family with 4 kids under 5, including twins.
So you understand my life.
Yeah, absolutely. So the mum I worked for, she had 2 boys, and then she had a surprise twins. So I went and worked for them. So I kind of knew, even when I was training to be a doctor, that I wanted to work with children. And so that's where that came from. And I absolutely love my job. But earlier this year, having had a lot of friends and family have children in the last year or 2, I found that I was being inundated with questions and lots of phone calls and messages asking my advice. And a few of my friends and family said, Lils, what you need to do is you need to put this stuff out, because there's so many mums out there that want to hear what you have to say, and they don't know this stuff. So I started an Instagram page, which is called Dr Lills, and so far it's going quite well. There's quite a few people in the community, and I share little top tips and bits of advice that I've picked up in my career that I think might be helpful for parents.
Well, I'm certainly a fan. I'm a mum fan, and I'm subscribed because I think it's brilliant what you're doing. And we're going to talk more today specifically about respiratory illness and from your experience in working as a medic. But let's just sort of get into the detail first of all, just so that everybody listening is absolutely clear. Let's start with the biggie then, the colds and flu. What's the difference between cold and the flu? Because sometimes people will say, oh, I've had the flu, and you might think, really, have you? But what's the actual clinical difference between cold and flu?
Sure. I mean, the reality is you're right. Everyone kind of uses those terms a bit interchangeably, and it's very difficult to tell because what we're talking about is respiratory viruses. And there isn't just cold or flu. There are actually dozens of respiratory viruses out there, although probably around 10 common ones. But even amongst those viruses, there's lots of different strains. And so there's so many different viruses out there that cause symptoms that we would call cold or flu. So, sore throat, runny nose, bit of a cough, temperature. And so really the difference to most people is probably how unwell you feel when you get that virus. If you're really unwell, you probably say, I've had flu. And if you're less unwell, you say, I've had a cold. Now, flu is a virus in itself. The influenza virus is a particularly nasty viral kind of respiratory illness. And so, yes, for sure, some people will catch influenza virus, and so they will have had the flu. But you're not necessarily going to know you've had the flu unless you've actually tested for it, which we can do in hospital. And occasionally when we see kids and they're very unwell with a respiratory virus, we will send off tests where we can look at the virus and work out which one they've got. So, and obviously now we have COVID tests, which similarly tell us if you have COVID virus. But now less and less people are testing. So, I think they are all a bit interchangeable, but there is a slight difference in terms of some of them will cause different symptoms than others.
So the respiratory viruses, is there a seasonality to them? Is it a thing that actually there's more of them in the winter? Is that actually a thing, or is that just what we've been led to think as parents or as families?
So there's been quite a lot of research on that, and I don't think anyone has actually come up with a 100% answer. People think that there's just more viruses in the autumn and winter and no viruses around in the summer, and that's why everyone gets sick in the autumn and winter. But actually the evidence suggests that probably isn't the whole story, that actually there are loads of viruses around in the summer, but for multiple factors we fight them off better, or we are less susceptible to catching them in the spring and the summer months, whereas in the winter we're more likely to catch them, and if we do catch them we're more likely to get sick from them. Now clearly once we catch them they go into our body, they start making more viruses, so probably to some extent there are more viruses around because more people are sick and therefore they're making more virus. But there are lots of viruses that are around in spring and summer, so lots of people will get a summer cold. And it does exist, but definitely at this time of year we start to see more people getting ill with respiratory viruses.
Mm-hmm. So I would guess there's also a lot of parents, families listening, thinking, it's quite common that my little one, I was looking at my Instagram this morning with various friends saying that their kids have got colds or coughs that they've picked up at nursery or preschool or from school, the gift of the virus that gets shared around. And they won't necessarily need to see a doctor because I would guess for the majority of the viruses, parents or carers can get their babies and children through that at home. What's sort of your recommendation for just managing a cough or a cold at home?
So kids go back to school at this time of year, they go back to nursery, they've had a break in the summer, we've all been outside getting lots of fresh air, and then suddenly you go back, the weather gets colder. There's some evidence to suggest that once we're colder, our noses are actually a bit colder, and then the viruses are more likely to get stuck in, basically. And then you put everyone back in a classroom with 30 other children or toddlers at nursery, and of course if you got something then of course that's when it is starting to spread. So definitely this time of year is when the viruses are enjoying life, and we are not enjoying life quite so much from a parent and healthcare point of view. But most kids will get, under the age of kind of 5 or 6, they'll get around 12 infections per year. So most toddlers will get one viral infection per month. And if you look at the fact that most kids stay a bit more well in the summer, so they may have a few months off because we're outside, we're getting more fresh air, there's less bugs around, that's going to be like 2 a month probably for winter.
I'm just calculating this with my 6 children and thinking that's why.
That's
now I know
why.
We just seem to have a permanent virus in our house. Right.
Yes, absolutely. And that is normal. And a lot of parents will say to me, oh, my child is always ill. It's like, is that normal? Yes, it is. And for those 12 infections, most of them you won't need to go to hospital or to a doctor with. Some of them you might, but most of them you won't. You can probably manage them at home. And I think there's some really good kind of simple top tips for medicines and treatments we can do at home. So things like for a runny nose, recent data has showed that actually saline sprays, so salty water, nasal sprays and nasal washouts. I think some people tend to kind of roll their eyes and think, oh, salty water, how much is that going to really help? There is actually really good medical evidence that suggests now that is really helpful, and it may even shorten the duration of a cold. So saline sprays or washouts, which you can buy over the counter in a pharmacy, can be really helpful for snotty children. And then you've got, Calpol and Nurofen or paracetamol and ibuprofen, which are good for temperature, good for pain. You can give those at home very safely. And then you've got a whole host of different advice that you can get, starting probably with reliable resources online, your pharmacist, then up to your GP, and then if you're very worried, 111 or A&E. So there is definitely support out there and things you can do to manage things at home. But the reality is that most children are going to get a lot of these viruses. And not all the time they're going to, very rarely they're going to need to be in hospital with them. They're just going to fight them off.
So I know that we always, as parents, sometimes we call a virus the gift from nursery or the gift from school because it's been gifted to them by another child. And I know obviously through COVID times, we became, obviously, even when we all returned into normality, much more focused on infection control. But what do we do about our children if they have a cold? Are we keeping them off school? Are we keeping them off nursery? Or are we sending them in? What's the advice now? At what level do we need to be keeping them at home?
Such a hard balance, isn't it? Because you're right, in COVID, we kept all the children stayed at home. And as a paediatrician, I will be honest here and say the first month of lockdown was the weirdest experience I've ever had because the paediatric ward was empty. There were no children, there were almost no children in hospital because we stopped the spread of all the other viruses, not just COVID, all the other viruses. And it persisted for that year. And then when we came out and we started mixing again, things came back, and they came back slightly differently to what we expected, and that we were seeing bugs in the summer, which we didn't normally see. And it seems to have kind of got back into a normal rhythm now-ish. But if your child is going to get 12 viral infections a year, you can't keep them home every time they have a cold because they'd never go to school. We have to be a bit pragmatic and understand that children have to build their immune systems. Therefore, they're going to have to get sick. We don't want them to get really sick, and we want to try and protect other children and potentially vulnerable children against the worst illnesses. So if your child has a bit of a runny nose, you're probably going to send them to school because they're going to have a runny nose quite a lot of the time. If they have a temperature, especially if it's a high temperature, like a temperature is over 38, if they've got a high temperature over 39, or they're in pain, or they're struggling with other symptoms on top of that runny nose, like breathing problems or really sore throat, then it seems sensible to keep them home, probably also because they're not actually fit enough to go to school and they're not going to get through a full school day. But the other one that particularly we don't want to spread around is diarrhea and vomiting. So I think most schools and nurseries have a pretty strict policy with diarrhea and vomiting bugs because they're super contagious, and obviously it's impossible to educate anyone if everyone's vomiting. So if your child has diarrhea or vomiting, you must keep them home, and you must keep them home until they're 48 hours free of any diarrhea or vomiting and all the symptoms have settled. And that's to prevent that spreading like wildfire. So if they have DMV, keep them home. If they have a cold, it depends. Chicken pox, they have to stay home. And I know we're going to talk separately about chickenpox, but that's another one that's super contagious. And actually, there's pretty strict guidelines on when to keep them home. But it's difficult. It's for sure. It's difficult. You might send them in and then they get sent home. So,
you get a call where your phone flashes up and it says the name of your child's school and you think, right, okay, I'm off. I know I'm being sent. I know I'm going home from work now. You talked there about the raised temperature and you started to talk about children being more unwell than perhaps just a runny nose. So colds and flu can get more serious. We know that. I've been through that experience with my children. When might parents sort of need to escalate? What sort of things might they be seeing when they realise that their child is actually more poorly than just a typical cold?
So I think almost all the viruses that I was talking about at the beginning can cause more serious symptoms. So most of them will cause a bit of a runny nose. Most of them might cause a fever, but only a small amount of them will, not the viruses themselves, but a small amount of those illnesses will then go on to be more severe. And I think the most common thing for kids in terms of severity is respiratory compromise or respiratory distress, what we call it as healthcare professionals. So those viruses, they go in through the nose, they land in the airways, and they start to cause inflammation of the airways. Now, we have airways that are from our throat up, which are our upper airways, and we have airways from the throat down, so our lungs, which we call the lower airways. Now, all of those can get swollen and inflamed, and the body starts to produce mucus, so snot, basically, to try and trap the virus, and then you cough it or sneeze it out. But that mucus and that swelling, in turn, makes it more difficult for your children to breathe and leads to the symptoms that I would possibly be more worried about. So swelling in the upper airways can cause noisy breathing or what we call a croupy cough or a barking cough. So that's a sign of upper airway swelling. And swelling in the lower airways tends to cause wheeziness and difficulty breathing. And again, a cough, but it's more of a kind of dry cough that is often worse at night. Now, I think, again, all of these things are a spectrum. So your child might have a little bit of this and be okay and be able to stay home. But once it gets to the point that your child is actually struggling to breathe with these, that's when I would want to see them as a paediatrician, because we can give medication and treatments to try and reduce the swelling in the airways and make it easier for children to breathe. And it tends to be that younger children and small babies struggle with this more than older children. But again, there's exceptions to the rule, of course, always. But the smaller your baby, the smaller the airways. So the less swelling required to make it more serious. Whereas a 8-year-old has bigger airways. So there's more swelling required to make it more serious. But yeah, I think respiratory distress is a big one. And knowing the signs of respiratory distress, which I don't know, do you want me to run through those now?
Yeah, share them, because I'm sure the listeners will be really keen to hear what they are.
I think in terms of respiratory distress, it tends to be you can see your child struggling to breathe. So breathing more quickly than normal. And you will know what's normal for your child and when they're out of breath. So breathing fast, sucking in their ribs or their sternum. So using all the muscles around their rib cage and around their neck to actually help them breathe. So their lungs themselves usually do all the work. You don't notice someone breathing. Normally, you just, you walk around, you're breathing, but people don't notice it. Whereas when you're struggling to breathe, you start to use all the muscles around your rib cage and your neck to actually help your lungs expand because they're struggling. So in smaller children, you'll see the dips between the ribs, you'll see the dips here in your chest sucking in, maybe up here in the throat will be sucking in. Small babies sometimes flare their nostrils or bob their head. Again, that's them kind of trying to breathe. And then the noises, so noisy breathing, either on every breath out, every breath in. Often with wheezy children, you can actually hear them wheezing from the end of the bed. But sometimes you can't. Sometimes you have to listen with a stethoscope. But often, when it gets bad, you can actually hear the noisy breathing. And those are all red flags for that swelling having got to a point where actually you need help, you need treatment.
And would that be, at this point, would you be a parent taking their child or baby to A&E? Or would they be ringing 111? What's the general guidance when you suspect that your child's got some respiratory problems?
I think it depends on your level of concern. So if you're looking at them and you think this isn't normal, but they're okay, you know, they're talking to me, they're sat up, they're still able to breathe, but I'm not happy with their breathing, then that might be when, if it's daytime, you would call your GP, see if they can slot you in. If it's nighttime, you would call 111. They may be able to get you out of hours GP appointment. But if you're looking at them thinking, I'm really anxious here, like they can't breathe, they're not breathing normally, or they're struggling to talk in full sentences, they're struggling, obviously younger babies aren't going to be talking to you, but older children struggling to talk in full sentences, or younger babies not wanting to feed because they're actually can't coordinate feeding and breathing at the same time, which is quite difficult. That's the point I would be worried enough to either take them to A&E or call 999. What will happen sometimes is you'll call 111 and they will be more worried than you from what you told them, and they will call an ambulance for you. Which does happen. That's absolutely fine. If you're not sure and you're like, I don't want to overreact and call 999, if you call 111, they will then escalate it if they feel it's appropriate to do so. And I think the other thing that's important to say here is that if you have a baby that's less than 3 months old, any temperature, so any fever above 38, is also a medical emergency. And that's because even though it could be a cold like this, it could also be something more serious. And if you have a 3-month-old baby or less, then they are more susceptible to more serious infections. So even if you think, it's just a cold, their older siblings got a cold, if they have a temperature of 38, you need to get them seen straight away.
Right, that's really good. That's really useful. I've got a personal family experience where, and I don't always necessarily come on to these podcasts just to tell you all about my poorly children, but this seems sort of particularly timely with our conversation today. We've had experiences with something called bronchiolitis. And I know sort of from what you've said so far, I'm nodding along because you're talking about these respiratory symptoms and some of the difficulty breathing and this sort of tugging or pulling and all that sort of thing. So I'm really interested for you to tell me a little bit more about bronchiolitis, but also for our listeners who may have heard of bronchiolitis before, what that is and where this sits in this relationship with this conversation that we're having today.
So bronchiolitis falls under that big umbrella of respiratory viruses. And specifically, typically it's caused by one virus, which is called respiratory syncytial virus, or RSV. So most people will just call it RSV because it's more difficult to try and say the full name. Having said that, bronchiolitis, a bit like colds and flu, we tend to look at the symptoms of the child and say, this child has bronchiolitis, before we've actually tested for a virus. So there are other viruses out there that may mimic the same symptoms. And so we may call it bronchiolitis, and actually it wasn't RSV, it was rhinovirus or enterovirus or whatever. But typically, historically, bronchiolitis equaled RSV virus. And it's one of those respiratory viruses that tends to cause more respiratory signs. So it will cause a little bit of a runny nose in some children. In some children, it won't cause a runny nose. It can cause a fever, but it might not cause a fever. But for most children who catch this, it will cause the swelling and the mucus in the airways. And that can be very mild or it can be very severe, and there's almost no real way of predicting which children will get this more severely than others. All we know is that the majority of children will catch RSV at some point in the first year of their life.
Right, because I was going to say to you, how many children are affected in the UK? So that's
almost
literally everybody.
Everybody, almost.
Wow.
But for some children, it will just be a bit of a snuffly nose. And for other children, it will be a really significant respiratory illness that may require hospital treatment. And I guess we have a few groups that we know will suffer worse. So premature babies who have been born early, who have maybe needed respiratory support in the neonatal unit, babies with other health conditions are much more likely to get bronchiolitis much more severely. Twins, for instance, who often come a few weeks before a singleton pregnancy, seem to, again, suffer a bit worse than other children, but that's not always the case. As I said, it's difficult to predict which child will get the worst of it and which child will be fine, in essence, with it.
Mm-hmm. Yeah. So there isn't because you sort of said it doesn't really there's no real known thing as to why it picks out certain children, and actually of my 6 children, 4 have been hospitalised with bronchiolitis and been quite poorly with it, and it was twins in both cases. And actually the virus, we don't know, it didn't leave a footprint, but we think it came from one of the older siblings bringing a virus home to very young babies at home. And I know that I've seen advertising around, if you think it's different when it's siblings. I know that because it's very difficult to keep children apart. I've got personal experience of that. But there is a thing now where in the media we're hearing, advice to parents is that if you're having visitors when you've got a new baby or a young baby, and that visitor thinks that they might have a virus, that they should really keep away. Is that a thing? I mean, is it good to keep people apart if you think that they've got a virus from young babies?
So I think in those first few months before your baby has really developed any immunity, and before your baby has had any of the routine vaccinations, which start around 8 weeks, I personally, if I had a baby, and I don't yet, but if I did, I would be very cautious about who came and visited my baby in those first few months. Now, obviously, you can't keep people away. You want your parents or sister or whatever to come and meet your baby, but they are actually very susceptible to these viruses, and they are more likely to get it more severely. And so if you do have visitors, firstly, I would limit it to your immediate kind of family and closest friends. I wouldn't be passing your baby round a party of 50 people until they're a little bit older. And I would be asking people, firstly, not to come if they have a cold, even if they feel like, it's a mild cold for me, it's fine. It's not necessarily going to be a mild cold for your little baby. And making sure that everyone who's going to hold your baby washes their hands very thoroughly with soap and water before they hold your baby. And I think sometimes people are like, I don't want to be that neurotic mum who, someone comes to visit and I'm like, do you mind just washing your hands? But if you end up in hospital with bronchiolitis, as you have, Kate, it's not nice, and you can be in there for quite a long time. Bronchiolitis, we say as healthcare professionals, is often worse on around day 5 to 7. So they get it, they slowly get worse. You often pick it up around day 2 or 3 when they've got a little bit of respiratory distress and a bit of a cold. Sometimes you end up in hospital then. Sometimes you end up seeing someone then who says, go home, see how it goes. And then it gets worse until day 5 or 7. And if you're going to end up in hospital, that's when you're going to end up in hospital on probably day 4 or 5. And then it's going to be bad for a couple of days, and they're going to need support with their breathing, and often with smaller children with their feeding, because when you can't breathe, you can't feed. And you'll know this because you've had this experience, but babies in particular, as soon as they can't breathe, they almost struggle to get anything in terms of milk. And so we have to support them with nutrition and their breathing until that settles down. And that can be 3 to 5 days. So then you've spent 5 days in hospital, which actually, if you can avoid that, and there's lots of times you can't because these things are out there in the world and you've got other children who are going to have to come home, and you can't lock them in different rooms. But good hand hygiene and good hand hygiene, things like if your older child is sick, not letting them cuddle the baby. Like, they're going to be in the same house as the baby, but they don't need to be cuddling them whilst they're nose is streaming and they're coughing, and like not sharing the same toys if you can avoid it. At night time, putting the plastic toys in the dishwasher on a hot wash to try and kill any bugs so that the next day they're killed. There's small things you can do, but I'm not naive enough to say that you can separate children so that they don't pass anything between themselves.
Yeah. So you've talked there about these worsening symptoms. So you've talked about babies and your very young children struggling to feed, and that can often be a concern then for medical professionals. And you talked about temperature and people starting to see or be concerned about breathing and then taking their babies to A&E. If you are presented with a child poorly with bronchiolitis or the RSV virus, what information do you need from parents to help you make sure that you've got the right information and so that you can make this diagnosis? So what sort of questions are parents like me when they turn up in A&E? What are they being asked?
So I think one thing that's really helpful for me is when parents have actually videoed what they were concerned about when they were at home. Now, we all have a smartphone now. So children change very quickly. And while some children will look exactly the same when you come to A&E as they did at home, lots of children don't. They either look better or worse. And a lot of these symptoms fluctuate. So sometimes the baby in front of me might look okay, but actually at home they looked much worse. And the mum's telling me that. They're saying at home they were struggling, they were sucking in here, they were tugging, they were making an odd noise. That's really common. Parents say to me, they were making a noise when they were breathing, and I'm listening and I'm thinking, they're not making a noise now. But if you've recorded that on your smartphone and then you show me the video, that's really helpful. Yes. The other things I want to know are, in the last 24 hours, is this getting better or is it getting worse? What day of illness are we? So when did you first notice these symptoms? Because, as we spoke before, it tends to get worse before it gets better. How much have they fed? So how much, if they're little, how much milk have they had? How much milk would they normally have? If they're breastfeeding, that's more difficult to quantify, but you'll know if they normally breastfeed for like 20 minutes and the last 24 hours, they've only gone on the breast for 5 minutes and then they've come off. And so they're feeding little and often rather than a big feed. How many wet nappies have they had? Have they been their normal self, like playing, or have they been lethargic, drowsy, clingy? Because those things tell me how their body is kind of coping with this illness. Are they still able to get in enough milk or fluid to stay hydrated? Are they able to stay alert, or are they actually really tired because their body's really struggling? And in terms of, their breathing, is what I'm seeing right now how they've been the whole time, or were they actually worse? Because I don't want to have a snapshot of 20 minutes in A&E where they look better and say, they're fine, go home. But actually at home they were worse, and then when you go home they look worse again.
Yeah, okay. If you are sent home and things worsen, so you talked earlier about the differences in the days of where you're at with virus. So it might be that you might be sent home in the early days of the virus because actually baby seems to be, or little one seems to be doing okay, and you get sent home. Is it okay to go back and go, I need a second opinion? What a doctor's receptive to people coming back? Okay. You said
I hope so. Brilliant. I hope so.
Yeah.
I hear people who say that they're, they've seen doctors that aren't. But I would always be 100% fine with someone going home. I've had parents come back in the same night. That's fine. Yeah. That's okay. Yeah. If what you see has changed. So what we've seen is that snapshot. We're busy in A&E. You've waited a few hours. You've been seen. I probably see people in like 10 minutes. And I have a set of observations with their respiratory rate and their oxygen levels at that point in time. Right. And I have to make a decision based on that, whether you are going home or whether you are coming into hospital. And sometimes babies will be on the edge where I'm like, they probably don't need to come into hospital yet, but they're not well. They're not their best self. So you give the best advice you can, and we have some, safety netting sheets where we show parents what they need to look out for and what they need to be worried about. And it's usually that respiratory distress, worsening, not feeding, becoming drowsy, or not rousable. The drowsy one is really tricky because it's often the middle of the night and children are asleep. So they're drowsy because they're tired. And then I send them away. And I want parents to feel like they can always come back. I want parents to be like, the next day, they didn't look like this yesterday. They looked better than this. And I was told that if they got this, this, and this, then they would need to come back. And it's fine. And often, if you do come back, that's when babies need to be admitted. Lots of the babies who do come in on day 3 get sent home, and on day 5 they get admitted. But it was actually, you didn't need to be in hospital between day 3 and day 5, and it would be much nicer to be at home. So you may as well go home and wait it out. And some children will never get worse. They will just turn the corner themselves and happy days. And other children will deteriorate. So, yes, come back.
Yeah, so with my and that's I'm nodding along because this is our experience, and you talking about videoing is really, really important, because the doctor that we saw in one of our visits to Annie said, "Have you got any video?" And I had one of my toddlers a video, and it looked, the only way I can describe it is it looked like her whole body was doing the breathing. Every bit of her seemed to be expanding and working really, really hard. And the doctor looked at the video and said, "Gosh, she's working really hard there, isn't she? She's working really hard." But at that time, when she was sat in A&E, it wasn't happening. It did happen later, and she ended up being admitted. But that's really interesting about having video, so that you feel that you can empower the parents, so that they can advocate for their child effectively, so that they,
and parents often look back and actually can compare the videos themselves. So they can say like, "Oh, I was worried on day 3. Can I look at that video? Oh, yeah. Oh, they look worse than that now." So they almost like themselves can justify, okay, no, that's fair, that they definitely do look worse. Because when you're sleep deprived and your child's been ill for 3 days, you don't really remember what it was like on day 3 when you're on day 5, especially if you have lots of children at home and it's really busy and a bit chaotic. And like advocacy is so important. I made a reel the other day, which has gone a bit viral, but it was basically a child who's like partying, and I said, sometimes you bring a child to A&E because you're worried at home, and then you get them into A&E and they're like, "Woo, I'm going to have the best time of my life. I'm going to jump around, I'm going to like play with all the toys, and I'm going to look absolutely fine." And then the mums are like, "I'm so sorry, at home they look really
wasting
sick.
Your time.
I promise, I've wasted your time." And I said, "No, look, you wouldn't have brought them in if they looked like this at home. I know that. But if you've then got a video that says, this is what they look like at home, then I can say, okay, I'm actually not going to send you home in 10 minutes. I'm going to watch you for 2 hours, because this energy spike might die down. And then like your little one will actually see the respiratory distress." Or I had an amazing mum who shared her story with me, who basically was really worried about her newborn baby, brought them into A&E, and initially they looked okay. They just had a slightly high heart rate. And I think she was on the verge of being sent home, but she really advocated for her child. She was like, "There is something not right here." And so they observed the child for a bit longer. And actually, when they observed the child for a lot longer, he started having pauses in his breathing, and it all got escalated very quickly, and he ended up having a very serious infection. So I think as a mum, you know your child best, for sure.
Mm-hmm. Absolutely. And I think that's a really good point to sort of wrap up our conversation, is this piece of this gut instinct. We talk about it a lot in our mini first aid classes, but just for parents and carers to feel that they know their child best and that they can advocate for them. We've talked a lot about infection control. We talked about hand washing and not holding babies. Is there anything else that we need to do to reduce the risk of our kids getting poorly, particularly through those autumn and winter months? Is there anything we can do?
So we have touched on the main things. I think
Yeah.
in September this year, they have introduced a new RSV vaccination for pregnant women. So that is being offered to pregnant women who are over 28 weeks pregnant now. And the idea of that vaccination is to, so the mum will produce antibodies to the RSV virus, and they should pass through the placenta and protect your baby in those that vulnerable period that we talked about, the kind of first few months of life.
Yeah, okay.
Now, that only started in September, so I think we haven't seen the full effect of that yet and how much that's going to reduce admissions with bronchiolitis and RSV. But I think that's something to think about if you're pregnant and you're offered that, you know, especially if you're pregnant and going to give birth in the autumn or winter months when there's a lot of RSV around.
Sure. Yeah.
And things like if you've got toddlers, you know, the seasonal flu vaccinations and COVID vaccinations, they can be helpful. And then the hand washing, as I said before, sounds lame, but it's honestly very effective. And soap and water is much more effective than hand gel. So washing with soap and water, kind of getting your kids into the habit of when you get home from nursery, when you get home from school, washing your hands before you go and play with all your toys at home, just to try and minimise the spread of that. Keeping your kids home when they are really unwell, and if they have any of those really contagious things, trying to keep them home so that they then don't go spread them around the whole of nursery. But I think it's just super important that parents realise that kids are going to get these things and you can't avoid them. You know, kids will get sick, and the best thing you can do as a mum or a dad is to actually know when to worry. Like, what are the things that you need to worry about? What is the point at which a cold is no longer just a cold and you need to get help for that? And allowing yourself to be empowered to not feel super anxious about it and just say, I actually know the signs of respiratory distress. So I'm not worried that you've got a runny nose. We're going to treat that at home. We're going to do some saline spray. We're going to do some Calpol. But when you develop those, I'm going to know that I need to call for help.
Brilliant. Lillie, on that, because we always ask at the end of our podcast for people to give us their takeaway, if people have fast forwarded to the end and they just want the one thing that you would say as a takeaway from our conversations today, would it be that, or have you got a top thing that you would want people to take away from listening to our conversation today?
I think, don't get bogged down in the naming of things. Don't get bogged down in whether it's cold, flu, bronchiolitis. Some people call it bronchitis. That's actually a different thing that adults have, but I get that bronchiolitis is a long word that is difficult to remember. Is RSV the same as bronchiolitis? Don't worry about all of that. They are viruses. They cause symptoms. Just know, as I said before, the signs to look out for, when to worry, and when to escalate to someone, health professional, be that your GP, your midwife, your A&E doctor. That would be my take home. Don't panic too much about all the details. Just know the basics.
Lillie, it's been fascinating to talk to you. I could talk to you all day, and in fact I can talk to you all day because we're going to talk about some other subjects which you'll be able to listen to on future podcast episodes. But please do check out our Mini First Aid Family Health podcast via our social channels. You can subscribe to the podcast so that you know when a new episode is dropping each week. We also have a newsletter which gives you top family health advice, and that arrives in your inbox every week, and that keeps you up to date with all of things relating to family health, for particularly if you are concerned at particular times of year, seasonality for things with our babies and children. Now, if you want to know what Lillie looks like, you can subscribe to her Instagram, Dr Lilles, but also if you jump over onto the Mini First Aid Family Health podcast YouTube channel, you can watch the video of our conversation. Sometimes people like to know what we look like, Lillie. So there we go. You could do that too. And you can listen to our podcast across all of your favourite platforms, whether you be Apple, Spotify, etc., etc. Now, if there are any topics in the future that you would like me to talk to a guest, a specialist expert on, please do get in touch. This was... respiratory illnesses and viruses was one of the big questions that we get asked all of the time via our social channels. So Lillie, thank you for coming and talking to us today. And don't forget, if you do have other subjects that you would like us to talk about, please do get in touch. You've been listening to the Family Health Podcast by Mini First Aid. Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. And just a little reminder from me and our sponsor, Things Happen, that if reviewing your life insurance is still on your to-do list, take time to get in touch with a Things Happen advisor today.